Will I benefit from under-eye surgery? I have extra skin and wrinkles on top of fat pads under my eyes. I'm still pretty young, and I've tried so many things to help correct it. Botox causes excess swelling in my fat pads, so I can't do that. I've had filler, but didn't help much, and I had a chemical peel to try to tighten, and it didn't help at all. I guess next step is surgery. Please help. I need advice.
Thank you for your question. You submitted a question describing a typical journey for a lot of the patients who come to me in my practice. When you first notice puffiness under the eyes, it is, of course, the first try is to use non-surgical methods, whether it's creams or fillers, as well as for the wrinkles, such as the use of chemical peels. Now you're at a point where you feel that you have tried a lot of these things, and the question is whether or not you're ready for surgery. Well, let's define what the issues are specifically from an anatomic perspective. You've noticed that you have puffiness under your eyes. Now, puffiness under the eyes that doesn't go away regardless of sleep and allergy and sinus management is basically a problem called lower eyelid fat prolapse. Now, lower eyelid fat prolapse occurs because the fat that's around the eyes pushes forward and becomes kind of like a hernia. Early, when lower eyelid fat prolapse is first manifested, you can get away with the use of fillers such as Restylane or hyaluronic acid type filler. But once you go beyond a certain threshold, then you have no choice but to consider a surgical procedure. And as far as the wrinkles are concerned, we can approach the wrinkles in a few different ways, but I think that now that you've exhausted chemical peel as being not satisfactory enough, I'll tell you a little bit about how I typically approach patients like yourself. So to begin with lower eyelid fat prolapse, I routinely perform a procedure called Transconjunctival blepharoplasty. Now what that is a procedure where I go behind the eyelid and I get to the fat pockets and I sculpt the fat pockets such that it looks like you never had fat pockets pushing forward. So it looks natural, there's no outside incision, and people really like having that type of procedure because no matter, even their eye doctor would have a hard time telling that they had surgery. So that's what I would probably recommend for you. Now to deal with the lines under the eyes, I think you're at a point where you would probably be a good candidate for procedures that we offer. One is called a fractional CO2 laser. Now a CO2 laser, the fractional type, the one that we use, is basically a laser which applied to the skin creates columns of thermal energy in the skin. And that thermal energy stimulates the collagen in a way that causes a contracting effect, and it basically kind of forces a tightening in the skin. And at the same time, it is a very quick recovery type of procedure. In addition to that, we use a technology called platelet-rich plasma. And with platelet-rich plasma, what we're doing is we're drawing your own blood and spinning it down and separating out the active healing component of the blood called the platelets. And what we're essentially doing is we're stimulating better circulation and new collagen to the skin. So we've had a very nice combination of using laser with platelet-rich plasma to help our patients with static wrinkles under the eyes, the wrinkles that are always there, no matter whether you're smiling or otherwise. Now, I would probably supplement and maintain you with a treatment such as Botox or Dysport in order to minimize the activity of the muscle so those wrinkles can be kept under control. So to summarize, my recommendation based on the photos you submitted and your clinical history that you submitted, I recommend transconjunctival blepharoplasty with fractional CO2 laser and platelet-rich plasma with a little bit of Botox or Dysport as maintenance. I hope that was helpful, and thank you for your question.